core connection breathing. And I'm gonna try really hard not to bounce on the stability ball because that's all I wanna do when I am on one. Okay, so if you don't have a stability ball, you can just have a seat on whatever you have available. I do want you on the end though, so that you have your feet firmly planted and this nice 90-degree angle in your from your knees to your hips. So core connection breathing, why is it important? When we breathe, it's directly related to the intra-abdominal pressure that we create through our core system. So through our torso, through those deep core muscle groups. And being able to manage that pressure properly is going to get you the best core connection, the best, you'll be moving your body as efficiently as possible instead of possibly creating other problems in your body. So this is not to scare, just so that you're aware. So if you don't have proper intra-abdominal pressure, you could create things like hernias or diastasis recti, but that's extreme. So this is just for you to be aware of what you want to happen. So our breathing and our core are directly related. So as we inhale, our diaphragm and our pelvic floor lower down. Our pelvic floor has the chance to relax here, so hopefully that's happening with you. And then as you exhale, your diaphragm comes back up and your pelvic floor rises back up as well. And that's when you have the opportunity to contract those muscles, or when you want to contract those muscles. Your pelvic floor is directly related to your whole core system, so it's a part of it. Our core muscles that we're going to be focusing on, as you can tell already, are your pelvic floor, and then we're going to talk about your transverse abdominis, so those muscles wrap from the back of your body to the front. Your core muscle groups are the ones that are closest to your spine, so they're not just in the front. We think about that a lot, but it also makes up these, it's called your multifidus, and these muscles run up and down your spine. Am I missing anything? So, when you do something like a crunch, you're working the superficial layer of your abdomen, your rectus abdominis. You can absolutely turn it into a core exercise, which is what you really want to be doing, which is why Pilates is kind of awesome for you if you've never experienced it, but for you to have a better idea about how to do that. But your core is what you're going to really contract and brace as you're doing your exercises, and that's going to keep your back and your posture nice and healthy and strong. So here we go. You are going to place one hand on your rib, on the side of your rib, and one hand on your belly. And I want you to just take 2 breaths in without any guidance and just notice where you're breathing. So inhale through your nose and exhale through your mouth. Inhale through your nose and exhale through your mouth. So maybe you notice that you're getting some chest rising and breathing, some abdominal breathing. So I want you now to see if you can kind of send that breath more to the ribs if you are not really getting too much of that. So our goal is going to be nice rib expansion to fill up along the sides and to the back of the ribs, and then to get a little bit of our belly to expand as well. So you're going to inhale into the ribs, so think side to side, and then send that breath to the back of the ribs and exhale. Okay, we're going to take another deep breath in. I'm just going to show you a side view. So again, inhale to the sides and back of the ribs. And then your belly will get some of that breath, and then exhale through your mouth. Okay, so now as you exhale, I want you to definitely make sure that you're making some noise and you are blowing out through your mouth like you're blowing out birthday candles. What I like to tell my clients is that your core contraction will meet the demand that you're doing. So a good example that I think is used often is like, if you're picking up a pencil from the ground, you don't need a big contraction, right? You don't even want to have to think about it. But you want to maintain neutral spine and good posture. If you're picking up your 30-pound child from the ground, you're going to want to use a little bit more core strength to pick your child up and maintain that good posture and core alignment, right? So for purposes of this video, you are going to focus on trying to feel that core connection. So I want you to think about blowing out 50 birthday candles. When I tell people I want a really big contraction, I tell them I want you to think about blowing out 100 birthday candles. You can kind of see where we're going here. So on your exhale, you are going to think about giving yourself a nice hug. I don't know if I mentioned it already, talking a lot here, but you're Your core muscle groups are often referred to as feeling like a corset in your torso, so you can think of it like that because they pull you inwards. I like to think about, like I just mentioned, a hug through your core, or I often cue my clients to draw their ribs in on the exhale. So I want you to inhale through your ribs. Exhale, think about giving yourself a nice hug. And hopefully you can see my ribs pull in and my abdominals stay flat and maybe draw together. Maybe you can see that. Now we're gonna add in thinking a little bit more about the rising of the pelvic floor, and the cue I like for this is a zipper from your pubic bone to your belly button. So if you think about putting on a tight pair of pants, hopefully you feel like, okay, I just pulled these muscles up and in, and that's exactly what we wanna do, and it will work with the drawing inwards of your transverse abdominis. So let's take one more breath in this position. Inhale into your nose, fill the ribs on your belly. Exhale, zipper up through your lower abdominals. So from your pubic bone to your belly button, pull the rib cage in nice and tight. All right, we're gonna take this down to the floor, and you're just gonna come down in a neutral spine position. So neutral spine just means your ribs and hips are in alignment, okay? You're not in this big arch through your back, and you're not flattening out your back. The only caveat to this is if you do have back pain, you can come into this more flat back position, okay? So that's always there for you. But to find your neutral spine, you're just going along with that natural curve of your spine here, okay? And then I want you to think about a neutral pelvis. So you're gonna place the heels of your hands on your hip bones and bring your fingertips down to your pubic bone to form a triangle with your hands. And just look up and you can see, okay, if you have a nice flat lower abdomen here, you could rest a tray on your hips and not spill any hot cups of coffee on yourself. So once you find that neutral spine position, same breathing here, okay? One hand on your rib, one hand on your belly. Inhale into the sides of the ribs. Now, you have the floor for good feedback into the back of the rib cage if you felt like you weren't feeling that before. So see if you can push those muscles down into the floor there. And then exhale, think about that zipper, putting on a tight pair of pants, and pulling the rib cage in and together. Give your body and torso a nice hug. Let's take 2 more breaths. Inhale through your nose. Expansion. Exhale through your mouth. Blow out those 50 birthday candles. Contraction. One more time. Inhale. And exhale, zipper from your pubic bone to your belly button. Knit that rib cage together, and there you have it. So this sometimes can take a lot of practice. Hopefully that helped to clear up any confusion that you may have about a core connection breath, and I'll see you guys next time.